Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Addiction Severity Index assesses the severity of substance use disorders and related medical, psychological, legal, social, and employment problems. It evaluates key domains such as drug and alcohol use, psychiatric status, medical conditions, family and social relationships, and legal status. The main purpose of the Addiction Severity Index is to guide treatment planning and monitor patient progress over time. It provides comprehensive and standardized information to support clinical decision-making and improve patient outcomes in addiction treatment settings. The Addiction Severity Index is indicated for adults with substance use disorders across diverse treatment settings. It is particularly useful for populations with complex presentations involving multiple areas of functioning, including medical, employment, legal, family, and psychiatric domains. The instrument aids in assessing severity and identifying treatment needs in outpatient, inpatient, and residential programs. It is also employed in research contexts to evaluate treatment outcomes and monitor patient progress over time. The tool's multidimensional approach supports individualized treatment planning and resource allocation in clinical practice. The Addiction Severity Index consists of 72 items organized into 7 functional areas: medical status, employment/support, alcohol use, drug use, legal status, family social relationships, and psychiatric status. The clinician administers the interview verbally, using both structured and semi-structured questions. Response formats include categorical yes or no answers, frequency scales, Likert scales ranging from 0 to 9, and open-ended questions requiring numerical or descriptive responses. Each area yields a composite score calculated by standard algorithms that quantify problem severity on a scale from 0 to 1, with higher scores indicating greater severity. Reference values suggest that composite scores below 0.1 indicate minimal problem severity. Scores between 0.1 and 0.3 reflect low to moderate severity, and scores above 0.3 signal significant impairment requiring intervention. Interpretation focuses on areas with elevated scores to identify priority domains for treatment planning. Consistent administration following the manual ensures data reliability and validity. The Addiction Severity Index demonstrates variable sensitivity and specificity depending on the domain assessed and the population studied. Sensitivity refers to the tool's ability to correctly identify individuals who have a substance use disorder, while specificity indicates how well it excludes those without the disorder. Studies have reported sensitivity values ranging from 0.70 to 0.90 for detecting drug and alcohol problems using the Addiction Severity Index. Specificity values are often somewhat lower, between 0.60 and 0.80, reflecting a moderate rate of false positives. For example, a sensitivity of 0.80 suggests that 80% of patients with a substance use disorder are correctly identified by the instrument. Conversely, a specificity of 0.70 indicates that 30% of individuals without the disorder may be incorrectly classified as having it. These metrics highlight the tool's utility in screening, but emphasize the need for corroborative clinical evaluation. The Addiction Severity Index was developed in the late 1970s by McClellan and colleagues at the University of Pennsylvania as a comprehensive, semi-structured interview designed to assess multiple facets of substance use disorders. Its initial validation involved samples from diverse treatment populations, demonstrating strong internal consistency and test-retest reliability across its 7 functional domains. including medical, employment, alcohol, drug use, legal, family, and psychiatric status. Subsequent research has confirmed the instrument's construct validity, revealing significant correlations between addiction severity index domain scores and external measures such as biological markers, treatment outcomes, and clinician ratings. Studies conducted in various settings and populations have reinforced the utility of the Addiction Severity Index in detecting changes over time, with reliability coefficients frequently exceeding 0.8 for primary domains and validity coefficients in the moderate to strong range. Moreover, the Addiction Severity Index has been adapted and rigorously evaluated in international contexts, further supporting its psychometric robustness and cross-cultural applicability. The extensive body of peer-reviewed literature continues to validate the Addiction Severity Index as a reliable and valid tool for assessing the severity of addiction-related problems and informing clinical decision-making. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.